Hello, I'm Etienne Schnur, Scientific Advisor at Ceramics and Biological Dentistry Foundation. We have become increasingly aware of the link between oral infections and chronic systemic diseases. I will address a very specific point in implant osseointegration that is related to areas of osteonecrosis. The pathology is primarily known as fatty degenerative osteonecrosis, but can also be called ischemic osteonecrosis or bone marrow disease. An accurate diagnosis is only possible with a CT scan because, like pathologies of the trabecular structure of the bone, the cortex is intact and very difficult to be seen in an orthopathographic X-ray. Methods of diagnosis are to use, as example, transalveolar ultrasound, the cavital, and also immune and histological analysis that we can determine bone metabolism and cytokines that are released during this pathology. Clinically, you see a bone with a very low density and instead trabecular bone, fatty tissue. This tissue should be completely removed. And using the table of Hounsfield units, and we take water as a zero reference of density units, fat tissue would score -100, and a healthy trabecular bone would have score +600. But what is really the relationship between the presence of fatty tissue and chronic systemic diseases? So the bone marrow microenvironment is a very important compartment responsible for bone homeostasis, as well as the balance between bone formation and bone resorption. Bone formation is mediated by osteoblasts, cells that are recruited from the bone marrow, stroma cells, mesenchymal cells, the same lineage of adipocytes. And bone resorption mediated by osteoclasts, which are recruited from hematopoietic progenitors. This system process is very dynamic and energetic demanding, controlled by the sympathetic nervous system and also many transcription factors, molecules that dictate the direction pathway of this differentiation. For instance, from the mesenchymal cells, in the presence of PPAR or adiponectin, you will have this path favor into the differentiation of these mesenchymal cells into adipocytes. And this adipogenesis is very well described during aging, during example osteoporosis and metabolic disorders. In the presence, on the other hand, of TGF-beta, these mesenchymal cells would differentiate in favor to the forming osteoblasts, and then we have matrix bone formation. So these substances, these mediators, are produced locally or released from tissues. As example, liver, skeletal muscles, the brown adipose tissue, white adipose tissue, central nervous system, and they affect the bone marrow through the circulation. Another very important marker for osteonecrosis are the pro-inflammatory cytokines, which are produced by immune cells during, example, the bone regeneration. And in this study, as an example, patients were evaluated for the presence of FDOJ and chronic diseases as breast cancer, as the vitamin D receptor deactivation or chronic fatigue, and cytokines of acute phase, normally seen TNF-alpha, interleukin 6-1, they had very low expression, while a chemokine named RANS was very high on those patients. This chemokine RANS, also known as CCL5, it is also determined in pathologies like atherosclerosis, multiple sclerosis, lupus, and other immune diseases. So the patients of Swiss Biohealth Clinic, they were also evaluated in association of oral interferences and FDOJ as one of the oral interferences, and quality of health of these patients. The patients that have higher numbers of oral interferences had also higher levels of indices on the MSQ questionnaire and worse quality of health. This shows us how crucial it is to pay attention to osteonecrosis areas on patients that report systemic chronic diseases, because since FDOJ is often an asymptomatic pathology, it can or may release mediators that would aggrave or predispose to chronic diseases, systemic chronic diseases. And then taking this all information together, maxilla and mandibular osteonecrosis areas must be removed, not only to ensure implant osseointegration, but also bone regeneration and control of chronic systemic diseases. Thank you very much, and see you next month.